We have an obligation to ensure that all Australians have equitable access to care, and so orientating health practitioners to the care of one group of people means that they're aware of that obligation, and that immediately orientates them to improving care for everybody. The second reason is that by thinking about how we can take into account other people's worldviews and their cultural values, it leads us to thinking more about people as people, being aware of our own sets of cultural beliefs and values and how they inform our practice, and it leads us to ways of communicating that enable us to value each other more as people.
If we're thinking about the opportunity that engaging with community offers Aboriginal and Torres Strait Islander people to be a voice and empowered to have a voice around the topic of precision medicine genomic research, we should also be thinking about, does that process of engaging with that community serve to benefit more broadly the Australian community? You know, is there a way of doing, being and knowing and sharing knowledge and engaging with the community that comes principally through an Aboriginal and Torres Strait Islander community sort of methodology that could serve to benefit other people? When you think about people and what drives people, it's really our emotional, connection to one another. And so I would say that it's not this procedural protocol type of a thing, engagement. Engagement's a fluid, dynamic thing that happens between a person and another person. Getting out there and building relationships with people serves to build trust, it serves to build rapport, and rapport ultimately and trust is what then gets people having a conversation that can be real, that can focus on the potential problems and concerns, but also come up with solutions.
At the moment we're failing in our care of Aboriginal people, whether it's domestic violence, whether it's housing, whether it's discrimination, whether it's racism. And really, if genomics goes the way it is, it's only going to be white middle-aged people who live in affluent suburbs who are going to be able to afford it, and it's going to have more inequity for Aboriginal and Torres Strait Islanders. And so I think it's really up to, it's a benefit for all Australians that we want to improve the health of Aboriginal and Torres Strait Islanders and as the politicians say, try and close that gap. But I think that genomics, if we're not very careful and not make it equitable to all Australians, it will just be another disadvantage that they have to bear.
Normally, we go to a funeral every Friday. The average life expectancy of an Aboriginal woman of Annette's peer group in our area is about 40. And so if there's anything that we can do that helps to understand and change that, it's really important. And understanding the importance of genetic diseases, not just the obvious ones like we see in childhood, but cancer, heart disease, diabetes, all those things is going to be really important and help to change outcomes for people. If you know your risks in time, then you have a choice. You can do something about it.
The way that Aboriginal and Torres Strait Islander people look at community, which is as a collective, serves to actually benefit, that way of looking at the world, serves to benefit everybody. If we could adopt some of those principles of how a person belongs to a family, belongs to a community, belongs to a wider community, and those communities are intersected and connected, it actually serves to reinforce a responsibility for the person, to family, to one another. That's something that's really invaluable. That's something that's potentially rewarding to everyone.